introduce myself. My name is Sumeer Kumar. I'm a former cricketer from Tamil Nadu. I was a wellness consultant too. And now I've come as a patient advocate for prevention of chronic diseases through lifestyle modification. But there's another story. I'm a two-time kidney transplant recipient, and I also had two open heart surgery, aortic dissection type A, and I had multiple surgeries last few years. You know, the surprising part is I had a very healthy lifestyle. I used to eat right, I used to exercise, sleep well. If you have a checkbox list, you'll see me ticking all the right things. You know, I was considered the best boy or good boy during my playing days. You'll see all the tick marks. I don't drink, I don't smoke, I was doing all the right things. I was not even hypertensive, I was not even diabetic. But my cricketing career was shortened due to acute kidney injury. One of the reasons, there were many, one of the major reasons were, during the playing days, they used to offer us sports drinks. You know, they say, have the sports drink, you'll fly like with the wings. I don't want to name the brand. That was given in excess. And we used to take other drinks too while playing matches. And playing in a city of Chennai, which is very hot, and obviously your consumption of water is not going to be enough, unlike today. And I would know that liberal intake of painkillers, which is you find over counters. So these all were the causes for my acute kidney injury. And thereafter, my life changed. And I went through a process where I went into dialysis, transplant. That's a big story. So, what I'm going to talk, so I hope everybody is aware there that one of the key reasons to chronic kidney disease is hypertension and diabetes. When you look at all these data, what are we getting to? We are going to find 1 in 3 person, as has happened already in Singapore, going to have kidney disease. And they have to go through the process of dialysis, which I don't know if is anybody experienced or have the family gone through dialysis? Yeah. Anybody else transplant? You know, the challenges are, especially with respect to food, there are a lot of restrictions for a dialysis patient. You're only allowed to drink 500 ml of water up to 700 ml of fluids, because you have to go you can't take potassium, because that basically takes off. You can eat fruits, you can't eat vegetables. A lot of restrictions are there in the diet. Forget about junk food. Good healthy food they can't eat. This is the condition. Do we need to land up there? That's my question. I don't know if people are aware. We're just talking numbers. That this is what's going to happen. Not only to kidney diseases, you'll end up with heart problems. And the cost, my God, nobody can afford it. Government claims and gives some amount of free dialysis, but that's going to cost you 2,500 per sitting. Can people afford? We're talking about poor people who are going to get sick. There's a lot of studies, like as a lot of people said during the panel, who are getting affected? The poor, from the lower class of society. If you go to schools and colleges, we had a small study done in a small school in Karnataka. Out of 500 students from 1st standard to 10th standard, they found out that 150, 160 students were pre-diabetic and hypertensive. Can you believe? And they are going to, in another 5 to 10 years, going to be chronic. And the kind of food we're going to eat now, which is highly processed, I don't think they will even go to 10 years. This is the kind of situation we are facing. And I don't think our country is ready for this. Our country in 2019 was not ready to handle the pandemic. Are we going to handle? We did not have, even during the pandemic, when people were not able to go to dialysis, we were stopped. That's the kind of situation we're coming to. I may sound very negative and pessimistic, but as we people are in a self-destructive mode, we are destroying the universe, we're destroying the soil, we're destroying our food, we're destroying everything. If this is the way we're going, we have no future for our children. I'm a parent of a 7-year-old and 11-year-old child, and I'm worried. I go, you know what is the mission for me now? I work as a volunteer for my Kidney Warrior Foundation. I go to schools and colleges, and I go and speak to them the importance of eating healthy, talking about living a healthy lifestyle through modification. Why? I believe the children are going to change our country. There is no point, or I wouldn't say no point, but it's very difficult to change the mindset of adults. We, as earlier Vandana Shiva said, have to bring the change in schools and colleges, and which Kidney Warrior Foundation has been doing it. I am going personally to schools and colleges. I find it a little difficult too, because half the time I go to try to speak to the principal, they'll say, oh, they have exams and they have this problem, they are on holidays. Yet, when we did go and speak to students, we talk about how at least they can provide good, healthy food in the canteen. Make the small changes. And we go to the Parent Teachers Association meetings, we talk to the parents, because I think as a parent, only can understand the pain of every child. Because I don't want my children, I don't want to see any of you going through the pain of dialysis, going through the pain of being in an ICU for 55 days, trying to live your life. So please, 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 I request all the panelists here, policymakers here, that think as a parent, as a citizen of India, and not look at just policies of profits or this. Because somebody, as Dr. Arun said before just, that here is economics, here is health. We have to make a clear distinction. But people forget an age-old ideology, that is, health is wealth. When there is no health, there's no point in sitting here and discussing. Because you'll be in the hospital and nobody gives a damn for you. Nobody will give except for your family members and for your children. So, if you ever want to bring and believe, please, please, please think individually. Bring a change in yourself. And this is a very strong message I'm putting, because there's no other way I can explain, because we have been only talking about policies. All this advertisement, this labeling. As an educated consumer, I have to see not just the salt, because I'm a transplant patient, I have to not just see salt, I have not only see sugar content, not only see the additives, not whether there is excess potassium. You know, I'm on immunosuppressant drugs. Now the food that was served outside with lots of vegetables and fruit, I am not supposed to eat raw food. You know, because there is a lot of pesticides in it. I don't know what kind of infection will be there. Water, I'm supposed to drink boiled water. This is the kind of situation we're going to lead. Can we afford it? I can't afford it. I don't think anybody is going to afford it. However rich you are. So please, please, again and again I'm begging you, this has to stop. This junk food has to stop. I am still trying to keep myself healthy and fit. And that is one of the reasons why I am still standing in front of you and talking. I'm very conscious about what I eat. Yet I've gone through these diseases. So there is no guarantee that that what you're going to do with all your illnesses, you're going to have a good quality of life or not. That is important, a good quality of life. So as a citizen of India and as a parent, as a mother, as a father, I beg you, please do this. Thank you.